am so very happy to be here today in this inaugural event. First of all, I want to start by telling you all I'm an optimist, a huge optimist. I am talking today about a topic that is saddening, right? I'm talking about COVID-19. And we know all the sad things that happen with COVID-19 and how devastating it has been and continues to be. And this is my time to tell you the pandemic is still on, full force ahead. And we are going to talk today about some of the silver linings that I see in COVID-19. Hopefully we have a call of action for some of the things that we hope that we can do with this. In 2019, in Wuhan, China, all of a sudden we started hearing about this pneumonia-like illness, right? And nobody knew what it was, right? And then sometime in January in Washington, D.C., instead of Washington, United States, we heard about the first case that we had. But it wasn't really until February that we started being scared. This is the first time that we heard about a case that was not from somebody that visited China or visited somebody that has traveled. This is the first community spread that we've ever heard. If you are in public health, when you hear community spread, when you hear of some spontaneous illness, you're going to be scared. And we started panicking. Our panic was, how are we going to combat this? Because we already knew what was coming. But infection prevention practices is very simple. First of all, the first thing you need to do is keep your distance from the person that is infected. So there was some debate on whether that is 3 feet or 6 feet, right? And then the next thing that you do is put a barrier, right? You have to wear a mask, you have to wear gloves when you're dealing with this person. Then the next thing you do is make sure that your hygiene is perfect. You are washing your hands all the time. You are also making sure that you are washing your coverings. But you know what we had as a problem? The problem was that there were no gloves. There were no masks. Why? Because the epicenter of this virus was in China. China is the hub for all manufacturing, for not just masks, but for a lot of parts of various equipments. So we had to do some things. I have to share with you that Onitsha did something wonderful, and I'll talk about that later. But the very first thing I do want to talk about is, where is that silver lining that I'm talking about? The first silver lining I want to talk about is in effective leadership. Effective leadership in crisis. When you see it, you recognize it. The first group of people I want to recognize here are the scientists and the clinicians. They did something phenomenal. What scientists and clinicians were able to do had never been done. They work collectively, collaboratively, all over the world with one voice, with one focus to stop this virus, to treat this virus. So how did they do that? They all gathered together. They looked at all of the work that has been done, any molecules that have been found before, any treatment that has been done. They were trying them. They were testing them. They were doing clinical trials so quickly, and they were publishing these results so fast so that we can see how to manage this infection that we've never seen before. So the leadership of our scientific community led to the production within 12 months, unheard of 12 months, messenger RNA vaccines from both Pfizer and Moderna that we can use to combat this virus. Now, it usually would take us 4 years to 20 years to manufacture a vaccine. It took us less than 12 months. And this became the reason why people started not trusting this vaccine, because they thought it was too fast. So can I tell you now that it was not too fast? The technology behind this vaccine has been in existence for decades. All they had to do was leverage that technology to start developing this vaccine, and they did it in record time. And if you read the literature, if you read the articles on this, these people work 24/7, 7 days a week to make this possible, because the world was facing a threat from a microorganism for a virus. So we have the scientists, and we thank them. And we have the leaders of the world, and I want to talk about those. The leaders of the world, especially the female leaders, Not because I'm female, fact. Germany, Iceland, Finland, those leaders did. Taiwan, they did things that were unbelievable. Okay, first, if we talk about Germany, the leader of Germany went to her people and said, we have a problem. She was honest, she was truthful, she just told them that without the measures that are going to be put in place, people are going to die. Over 70% of the population will be infected, and she was not joking. This is a fact. So the people believed her and took on the measures, right? Then we have the Taiwan leader, and what did she do? She had 124 different measures that she had in place that to combat this virus. She was able to stop the virus, decrease the rate of infection, very little death in Taiwan without shutting down her country like most of us did. Then we have people that use social media and testing, Finland and Iceland. Then we have the compassionate leaders, like in Norway, that focus on the children. What did she do? She had press conferences, questions and answers from the children, no parents allowed, able to tamper their fear, and then the children were able now to work on their parents to do what? To adhere to the measures that we want. Those are examples of great leadership. So Onitsha had something even better in His Royal Majesty, our own Abogidi, Nnameka Achebe. What did he do? And when, as a scientist, as a clinician, I think about what he was able to accomplish, it is nothing more than an incredible feat that he pulled off. The first thing that he did was he did the technology thing. We had Zoom. So he did virtual town hall meetings, right? Remember Norway? Focus on the children. What our Abogidi did, what our royal father did, was he called a town hall meeting of all Onitsha indigents, explained to us what was going on with COVID-19, told us the status, and then he started recruiting people to start working on this, right? Then he actually got a COVID response team together. That COVID response team was now going to try to augment what is going on with the Anambra State government in the grassroots levels, right? And they now were the ones that we eventually started working on the COVID response that we now know with our well-being ambassadors, and I'll talk about this a little bit more. So remember that I told you there were no hand sanitizers in the world. There were no masks in the world, right? But what did Onitsha do? What did we do under his leadership? We started manufacturing our own facial coverings with Ankara and cotton cloths. We made so many of it that every Onitsha indigene, anybody that wanted to get one, got one. And we made sure everybody got one. We also were able to manufacture our own hand sanitizers using the World Health Organization's guidelines, supervised by Onitsha indigenes that are experts in that area. So we were able now to not only do the two things you need to do with infection prevention, which is what? The barrier, and then the other one is hygiene, okay? So we did all of those things. Now, in addition to that, the healthcare professionals from all over the world, we came together and we started working on how to educate the people, how to sensitize the people about COVID-19. And we did that by developing a toolkit. This toolkit was used to educate our volunteers who became our well-being ambassadors. They combed out all over Onitsha, talking to people, going household to household, making sure that people understood what COVID-19 is, the symptoms of COVID-19, how to prevent it, and how to react if you have those symptoms. I do want to talk about our healthcare professionals, but before I do that, I forgot to mention the campaign that we had, the Nduka Ifenine campaign. The Nduka Ifenine was a media campaign, media blast. If you remember at that time, there was all kinds of media blasts. We have posters, we have town criers, we had town criers, and we also had individuals that were talking about this in different social medias, talking about the preventive strategies, saying that life is more important than anything else. That's what Nduka Ifenine means. So let me give an applaud to our local physicians. This was never done anywhere. What did they do? They offered their own telephone numbers on those toolkits. So if you do have symptoms, and if you think that you have COVID-19, or if you turn positive, you can call that number. They will be there to support you and support your families throughout this process. And this continues with our vaccination process today. The same strategy continues. Abogidi's goal is to bring the care to the people. And that's exactly what we're doing. In fact, on next week, Monday, we're going to have vaccinations in Imobi, Oboza. So which is another way to make sure that people are vaccinated, and we're combating some of those issues that we have with vaccine hesitancy. So, last thing, you will think, okay, we have done all this education, but what about the crowds? How did we manage the crowds, right? I want to let you know that he has several proclamations, and one of them was limiting crowd size. We had 2 years of no Ofala in 2020 and 2021. If you're not familiar with Ofala, Ofala is one of the greatest celebratory events that we have in Onitsha. It is a lot of fanfare. People come from all over the world, thousands and thousands of people. Abogidi said absolutely no to any of those. No celebratory Ofala. All of the rites were observed, but none of the fanfare was there for 2 years in order to prevent that. The next thing that he did, other than the proclamation, was also to make sure that every event limited crowd size according to the NCDC. In my particular institution, another example of leadership that I do want to talk to you about is about how we manage our emergency preparedness. I personally had to write lots and lots of scenarios. What happens if I only have 25% of my staff? How would I manage our patients? Do I have enough medications? All of those things were all taken into account. It was a lot of sleepless nights on my part. I have to worry about my team, my staff. Are we going to get infected? How do we work together in small spaces? How do we manage each other? Do we have enough medication? Can I assure safe practices in medication delivery? And we're able to do all of that. We did not see any significant errors that occurred during that time. One of the things that I want everybody to leave home is that we need to have food security. Agriculture is the way to go. If you don't know, please get into farming. If you need to invest in anything, farming is where we go. We are importing our food. We should not. We have a lot of fertile land, a lot of innovation, and we need to make sure that we are feeding ourselves and not dependent on imports. We are importing fish, for God's sake. We can do that. We can actually produce our own fish. So the explosion in technology is the next thing that I want to talk about. We're here because of that explosion in technology. We can now do everything virtually and remotely, including healthcare. I just want to really tell you that I have been so impressed and so moved by the work that is done by this team here. And I want to mention some of our great tech folks, Charles M. Mbalo, NECA UK, Obiasika, who's hosting us, the organizers of TEDxUgwunobamkpaRd. These are people that we need to look up their work. We need to engage with them, and we need to invest in what they're doing. So I do want to talk about the last silver lining, not the last, but almost the last silver lining, which is appreciation of the wage worker. I'm a wage worker. I go to work, you pay me the money for that. I don't own my own business. Well, we were all in the front line. The people that are farming, the people in the factories, they were in the front line. Those are the ones that died the most. Those are the ones that were infected the most. So we need to respect the work that they do. And we need to pay the wage worker a really fair wage in the process. Don't grumble over the amount of money you're paying because you didn't have to go there and raise the chicken and pluck the chicken and cut the chicken. They did all that for you, and it took a lot of work. What is encroaching? The clouds are now encroaching on our silver lining. I'm just going to name a few. One of them is the toll of the pandemic. We're all so tired, right? We're so tired of the pandemic, and we need to really think about our mental health, take care of ourselves. Ndoka Ifenine. Resilience. We're so resilient, but resilience can become complacency. Let's not be complacent. Let's really realize that COVID-19 continues to be a global threat, and it will continue to be a global threat until the globe, the developed nations, the rich nations understand that. Right now, we are seeing discriminatory practices against brown and black people, against the poor nations on our access to vaccines. It is so not right when 50% of developed Europe, greater than 50% are vaccinated, and you look at some of our brown and black nations, less than 5% of their population are vaccinated. That is all to do with access of vaccine. And in addition to the access of vaccine is also that people are hesitant about vaccines. I'll be here to talk to you about it. I can talk anybody out of not taking the vaccine. I think everybody should get the vaccine, all 3 doses of it. So my plea to everybody, to the diaspora, as I close today, is all hands needs to be on deck. You need to engage, re-engage. Please do not disengage. If you look at the data, immigrants are the reason why a lot of the innovations occurred in the world. We are those immigrants. We left our nations and went somewhere else. So if you are like me, please reach back to your home country and try to make a difference. Share your expertise, engage your youth, make sure that you, as a person, you're making a difference. Collectively, we can definitely make a difference. And I do want to let you know that distance is no longer a problem. You don't have to fly on the plane to come here. We have remote talks. So for our youth, I'm going to close. The youth, you are the greatest silver lining that I see.